Hey, Doc, welcome back. We're attacking biochemistry with this question. So, like we always say, please read the last three lines. It's very beneficial, and I can promise you, once you get comfortable using this technique, it will save you time. You have better clarity of what exactly the patient, meaning the patient encounter, wants from you. So then when you actually read the whole scenario, you're not just trying to figure out what they want from you. You already have an idea, you have a goal, you have a certain focus. You just got to read the scenario, pull out the pertinent findings, and then just attack and get the answer. So let's begin with this one. Treatment is with methotrexate. Okay. Pharm is everything, guys. I'm telling you, you can't run away from pharm. And a follow-up examination. AST is 75. ALT is 81. So open the labs. You'll see less than 40 is normal. One is 38. One is 40 on the high normal. Anything over 40 is abnormal. So when you get comfortable with labs, you can pull it up, no problem. On the exam, same thing. Open up, put it to the side. But when you keep working on questions, seeing scenarios, you get comfortable with lab values. So moving forward, AST, ALT, anything over 40 is abnormal. That's it. So it's not in the thousands, but it's higher than 40. So these are abnormal. Which of the following substances is essential for the function of these enzymes? Now, we got to go to the top, read the scenario, but you have a better idea of what the case is asking of you, right? We were given methotrexate to the patient. AST, ALT are higher than 40. What's going on, right? Which following substances is essential to the function of these enzymes, for the function of these enzymes? And if you're not understanding what they want from you, let's just say you just don't understand. Read the answer choices. Now, you know me, and I'll keep saying this, I never like to go to the answer choices. But after you read the last three lines, and you read the first 3-4 lines, and you still are not clear of what they want, read the answer choices. Because now, if we decide to go, let's just go see for ourselves, we see different vitamins here. Niacin, thiamine, biotin, and so on and so forth. So, okay, they're probably asking some cofactor, because all these are cofactors with certain pathways, right? So we need these to function to produce certain products from substrates. If we don't have these guys here as cofactors, hey, it's not working. So that's a little trick, okay? Now, let's go to the top and see what the case is talking about and go from there. A 36-year-old woman comes to the physician because of prolonged stiffness in the morning and progressive pain and swelling of her wrists and hands over the last 4 months. Examination shows bilateral swelling and mild tenderness of the wrists and second, third, fourth metacarpal phalangeal joints, MCP. Her range of motion is limited, so they're spoon feeding you rheumatoid arthritis, right? And on top of that, they say serum studies show elevated anti-cyclic citrullinated peptide antibodies. I'm telling you, ladies and gentlemen, they will spoon feed you information to some point. So not only did they give us the medication that was prescribed, some lab values, which are not normal, then they present to you a case which literally telling us it's rheumatoid arthritis, then they tell us some serum studies. So this is important to know. These markers, these antibodies, they're affiliated or associated with certain conditions are a must, because once you see anti-cyclic up, automatically up, I know it's RA. Okay, good. Now, how do we proceed forward? The problem with this kind of question is you need to know what these do. You need to know what these are cofactors for, meaning niacin, you think of pellagra, right? Triple D, dementia, diarrhea, dermatitis, and possibly death. Thiamine, wet berry, which is B1. Biotin is B7. Ascorbic acid is vitamin C. Folic acid is B9. Riboflavin is B2, and pyridoxine is B6. So you have to have an understanding of the vitamins. And I know we all know the water soluble and the fat soluble, and this is biochemistry, and please take advantage of this time. You need to know about deficiencies and toxicities. That's why I picked this question, because we might know what they are. We hear them all the time. But when it comes down to answering questions for the board exam, they love to really pick at you and say, do you really know what happens when a person's deficient in a certain vitamin versus what if they're taking too much of the vitamin? And why not test yourself to see if you actually know it, right? So all these vitamins here have a certain purpose. Being that we need to know what each one is, we then compare it to what they're asking us here. The person's on methotrexate, elevated ALT, ASTs. So we got to figure out of all these, which ones actually will cause issues in the liver. Niacin, out. That's, like I said, triple D, right? Diarrhea, dementia, dermatitis. Thiamine, it's more for wet beriberi, and it's a B1, and there's no indication that in this case would be causing issues with ALT and AST if you're taking thiamine. Biotin is B7. In this case, it doesn't really relate to the case itself. It doesn't present this way. Ascorbic acid is vitamin C. Vitamin C is dealing with hydroxylation, with collagen formation, nothing related to what the case is involved here. Folic acid is B9. Folic acid B9 is like macrocytic anemia. As we know, B9, B12, macrocytic anemia. In this case here, it doesn't relate to what we see. And it could be this easy because, even though RA is a case, they don't tell us it's RA, but they present to us it's RA. That's fine. We need to know what these do and what pathways they work in, what cofactors they're involved with. So then you'll be able to come up with the answer. So folic acid is B9, that's out. Now we have pyridoxine and B2. B2 riboflavin is cheiliosis. Typically, B1, B2, B3, you need to know those specifically because they'll love to ask you questions on STEP exam. There is no profile dealing with hepatotoxicity or any hepatic injury, dealing with high elevated enzymes, transaminases, because these are transaminases, right? So when you are reviewing vitamins, whether it's water soluble, fat soluble, you have to understand where they are working at and what would happen if there's deficiency of them versus what happens if there's some side effects to them, right? So this is riboflavin. You need to know presentation. This doesn't work with transaminases, so that's out. So by default, knocking out the answer choices one after the other, you're left with pyridoxine. Now, you might not have seen that right away. You might not have realized that pyridoxine was the answer. If you did realize that, congratulations, I'm happy. If you didn't, then you have to have patience and knock out one by one. When you do that, you start working on more technique, you work on more education, more knowledge of your basic sciences, and then you feel more confident. Because in this case here, when there's a deficiency of the cofactor required for transaminases, right? Then what happens? Irritability, peripheral neuropathy, sideroblastic anemia. You might say, wait, hold on. I know about B6. I know that if there's B6 deficiency, this happens. But you see, they didn't give us sideroblastic anemia. They didn't present to us any hemoglobin levels or any pathological slides. They didn't mention about peripheral neuropathy. They did talk about swelling and pain, but they didn't really present anything about a case that has peripheral neuropathy. And all they did was show us that the transaminases are high. You see, they're not less than 40. They're higher than 40. So that's why you have to be very, very careful when you answer these kind of questions because they can get you from different angles. So B6 here, pyridoxine. If they put in pyridoxical phosphate, you need to know that it's the active form of pyridoxine. So whether it's B6 or pyridoxine, please be familiar with both. Just don't depend on the letter and number. Like, I know what B1 is. You need to know what these are. If you do not know, they will get you on exam day, okay? So these are required for glycogen and phosphorylase reactions, decarboxylations, and so on. Synthesis of what? Cystathionine, heme, niacin, histamine, as well as neurotransmitters. So you see, they can get you from different angles, including in CNS. So methotrexate, the drug that was prescribed, okay, when you hit this one here, it's a DMARD. I did that purposely. Disease-modifying anti-rheumatic drug, DMARD. So if they put DMARD, you need to know. Also, they just spell it out like that. That's a nice tool that they have in AMBOSS. You can just click it and refer to it really quickly instead of losing time and running around, open up books and videos to find out what it means. When you give methotrexate, people who are diagnosed with RA, it can cause minor transaminitis, right? Or in some cases, rare cases, severe drug-induced liver injury. At the end of the day, remember, it's not a fair test. The individuals who are submitting these questions, MDs and PhDs, they do their very best to test your knowledge, but also they want you to think a little further, right? So don't expect to always see a case that has sideroblastic anemia presentation, or a person that has peripheral neuropathy. No, but with B6 deficiency or B6 in general, they will always present something about transaminases, high ALTs, high ASTs, obviously over 40, not in the thousands, that's viral hep, but they will always present something with transaminases higher than normal, and then they might throw in a slide to tell you it's sideroblastic anemia, or they might give you MCV less than 80, which is one of the four which is one of the four microcytic anemias. We have iron deficiency anemia, anemia of chronic disease, we have beta thal, and then we have sideroblastic anemia. So you see, as I'm talking now, and I want you to do that too, even though we're doing biochem, branch out a little bit. Say, well, do I know the anemias? Do I know the microcytics, the macrocytics, right? Folate and B12 are macrocytic anemias versus what I just mentioned were microcytic anemias. So even though it's biochem, and maybe you're watching these videos now and you haven't touched organ systems yet, which is fine, but eventually you will. And then you see everything kind of overlaps, okay? So this kind of question is tricky because all they give you is, hey, these two levels are high, and we need to know the substance is essential for the function of these enzymes. It's a cofactor, B6. Big, big, big topic. It's going to be tested on your exam 1,000%. I would take my time, review all these vitamins one by one, because it's going to be very, very beneficial. These are easy points on exam day. You make sure you know the water-soluble vitamins and the fat-soluble vitamins, okay? Awesome. I'll see you guys on the next question.